Thank you for choosing Dunkin'. How can I help you?
Hi, good morning. Can I get a medium iced coffee with the coconut shot, the unsweetened one? Just a little bit of creamer as well, please. A strawberry frosted donut.
With sprinkles?
Yes, please.
All right.
When I realized that Dunkin' opens at 5 a.m. Yes. And you know what? If I have to be up at this ungodly hour, I'm at least gonna have some good coffee and a donut for breakfast. Good morning. Welcome to my YouTube channel. It's really early. I'm Dr. Daisy Sanchez. I'm a third-year general surgery resident. I am making this YouTube video to take you guys with me on 120 days on call. I mean 120 hours on call. 120 days would be cruel and unusual. So like I was saying, I'm in my third year of general surgery training, and currently my co-resident is out. So on this service, there is myself, a third year, and then a first year intern. She's currently on vacation. I'm happy for her. I am covering this week by myself, which is why I'm on call for 5 days in a row. So I will take you guys through this with me, and hopefully it doesn't get too chaotic and I'm actually able to film and show you what it is that a resident does when they're on call for 5 days. Okay, the first sip. This is so good. It is approximately 5:15 right now, so I'm gonna go into the hospital, get all of the patient information, and then go around and see all the patients, make rounds. There's 2 medical students, so I have to find them as well. And then get ready for cases, which are gonna be starting at 7:30. So before then, I have to look every patient up, see them all, come up with the plan, put in any orders, talk to all the attendings, make sure my plans are reasonable plans, and then get ready to go to the operating room. God, it's been absolutely crazy this morning. I'm running around. I have not stopped seeing patients because we keep getting consults, and then we added an emergent case for a patient that had a weight loss surgery that now has a leak, and an emergent surgery for a patient with a bowel obstruction that may have a recurrence of cancer. I just got another emergency consult, so I'm running down to the ED to see this consult. Consult who we are not going to operate on right now, and I'm finally getting over to the OR for our emergent case because she's back. Run, run, run. Run! All right, I'm heading back to grab my gloves, gown. To the ED again. Got another consult. This consult is for a patient with a lot of nausea and vomiting, having some severe reflux as well, so we'll see. I think I am lost. Gotta find this patient somewhere. I sat down for like 5 minutes to eat lunch. I'm also getting messages on my Epic chat, so we use Epic here, and of course everybody knows that you're on call and sends you all the questions in the world, so we are busy. So I just got alerted that our next patient is in the operating room. It has been a crazy day. Crazy. Is it me going to the ED again? Yes, I have another consult. Okay, I'm finally done with kind of the day tasks. So I've put in all the orders, I've checked on all the patients. Now I am on call, so I may have to come back in. So I'm gonna head over to the gym, which is pretty close to here. That way I'll hang out there for about an hour and a half. If I do get called back in, I'll just kind of head back over. I live about 30 minutes away, so I just got to the gym, but I'm sitting in my car catching up on some messages because we use the Epic system and I have the app on my phone. And so all of the people that message me, it goes straight there, and I have to answer all these messages because I'm on call. So for the next 5 days, catch me glued to my phone. Around 8:03. 3. I got some messages and some phone calls about patients, so then I had to make some more phone calls, and now I'm putting in some orders and making sure that everything's good. It is day 2. I got up around 4:30. I set my alarm at 4:15, but then I snoozed it. I'm on my way to work now. I also got up around 3 because I got some messages from the hospital, and so I woke up to answer that. That only took about 5 minutes. And then it took me about 20 minutes to fall back asleep. So, and then I woke up again. All right, I have about 15 patients that I have to go see, and then we have 4 cases for one attending, and then 2 cases on for another today. We had 2 new consults, one of which we added to the OR schedule. I went and did a dressing change on a patient that needed it, and I also wanted to look at the wound. So now I'm finally going to the OR for our first case. There's 3 more and then an add-on. It's only day 2. All I needed was a little coffee. Oh. Dr. Edwards, introduce yourself.
What up?
Who is this? Is this Lucia?
Hi,
What would you like to say to the future doctors of America?
Remember, a surgeon is often wrong, but never in doubt.
Correct.
Words so bad.
Words from a wise endocrine surgeon.
Easy for her to say.
Right. Words from a resident. Piece number 2 is done, and now I'm gonna go get coffee number 3. Feels like I'm running around chaotically because I am. Going to the ED again. Get a consult there. Donde está? We got 2 more cases to go. Right now we have another hernia repair, an inguinal hernia repair, and then after that we have a patient with a gallstone ileus, so we're taking him to surgery. Basically his gallbladder produces stone that then went into his bowel and has caused an obstruction. The list has grown to 20 patients, 14 patients this morning, so I'll have to be here super early tomorrow. Another consult. One more case to go, still waiting. I'm not sure when it's going because it's an add-on and there's a bunch of other cases before it. But first I'm gonna just lay here for a second because I actually haven't, I don't think I've actually sat down all day. I have been up on my feet since like 5 this morning. Oh my god, this feels so good. This feels so nice. Okay, update. I'm sitting in a call room. We have a case that's added on to the OR schedule. However, there's a few emergent cases that are going before, so I have no idea when this case will actually be going. The sun has gone down. I am still here, and I don't know when this surgery is happening. So what I'm gonna do in the meantime is I'm gonna lay here for like 15 seconds, and then I'm gonna go back to a computer and I'm going to write a handoff or any updates on all of the patients. I need more coffee. Look at this. Look at this. Oh my god. I just worked over 17, I think 18 hours, which is fun. Day 3. Oh god. Oh god. I did my makeup this morning, so that's a plus. I've got about 17 patients to see this morning. Why are hospitals so cold? Why? Why? Is it necessary? Oh, the nicest lady just gave me a blanket. From the blanket warmer, it feels so good. I'm going to work on some notes quickly before I run to the OR. This is a dragon. I want to show you guys this. This is actually what we use to dictate. So you press this button, you talk into this microphone, and whatever you say gets translated into text onto your notes. Saves a lot of time when note writing. Oh my God. What? Holy shit. I actually cannot believe what just happened. So we were in a case doing surgery, a robotic surgery. So everything's set up, everything's going well. We're starting the surgery, and then suddenly we look over because we hear what sounds like kind of like dripping. It almost sounds like when it starts to rain, like you start to hear things. So we look over to the corner of the room, and it is in fact raining from the ceiling. Freaking water. Water is coming from the ceiling. It is literally dripping water from the ceiling. Where is it coming from? We don't know. We are operating on this lady robotically. How does this even happen? I have never in my life seen this before. No, scratch that. When I was a medical student, there was a time where there was a drip in, there was also something similar. It was significantly larger, actually. It was dripping like a freaking fountain of water, but it wasn't in the operating room. Because that's a problem, especially when you have a patient literally on the table open. And this is some Grey's Anatomy shit. Like, where does this actually happen? Luckily, we were at a point where we could kind of wrap things up quickly with the surgery. And so everybody kind of came together and wrapped everything up very quickly, got the patient closed safely. We got the patient out of there, and oh my God. What? I was tired, but now I'm awake. I need coffee though. We got some coffee. That was weird, but I just... Now my coffee slushy. So the two remaining cases are the removal of a gallbladder and then a take back case on a woman who had a volvulus, meaning her intestines were twisted, and so we untwisted them, and then now we're gonna take her back and just make sure that her intestines are still alive. This is the surgeon's lounge here, but usually if I want coffee I just go down to the physician's lounge, which is on the first floor, and they have coffee machines, they have ice cream machine, they have all kinds of snacks, honestly. So I'll be on call today, and then I'll be on call tomorrow, Saturday, and then also Sunday, and then I will be working Monday through Friday next week and splitting the call with my co-resident, my intern, and then I'll be off the following weekend. Leave this here because, like, why would anybody want to steal this? Also, maybe people are trying to go home because it's Friday. There's clearly not that many people in here. Put this thing on. So cute. Little glasses. We have a consult. I love this lady. She's like the sweetest consult ever. Little 91-year-old lady. We're not gonna operate on her, but she was awesome. Heading back to the operating room now. Oh look, it's the sun. Day 4 of being on call. It is Saturday. As you can see, it's a little bit brighter. I'm going in a little bit later, so I left my house around 6. It is like almost 6:30, and I'm almost to the hospital. I had to stop by and get me a little Dunkin'. I got pretty much the same thing, a medium iced coffee with like the unsweetened coconut shot, and then I added the cold foam today. Oh, this is really good. I'll see any new consults that came in overnight. And then we have a case scheduled today. So it's actually gonna be a pretty interesting case. Morning. It's kind of a redo surgery on a patient who's had multiple other surgeries by other surgeons and is now having severe reflux. Today we did 2 cases. So the first case was a partial fundoplication, which essentially, in the simplest of terms, means that we wrapped part of the stomach partially around the esophagus. This patient was having really bad reflux and has a very, very complex history, starting with tracheoesophageal fistula. She underwent repair at a very, very, very young age, pretty much right after birth, and then subsequently underwent multiple other surgeries, resulting in her having this kind of pretty bad reflux. So we took her back to the OR, and we didn't really know what to expect, because with these types of surgeries you can have a lot of scar tissue, and this can take all day or this can take a couple hours. Everything went fine. She did have a significant amount of scar tissue. However, the surgery went pretty smoothly, I would say, and so she's in post-op recovering now. And then the second case was a laparoscopic cholecystectomy. So this was a patient that came in with acute cholecystitis, meaning her gallbladder was inflamed. And so we took her to the OR, removed the gallbladder, everything went fine. After the OR, I called the family, spoke to them, reassured them that everything went well with the surgery. Her husband was extremely nice, super thankful. A few things about call schedules with surgery residents. There are different types of call, first of all. Different programs have different requirements for what being on call means. These past 5 days, the reason why this is legal to be on call for 120 hours straight is because it's not in-house call. So I'm not technically in the hospital working all 5 days. It is home call. So I come in, work during the day, and then I'm on home call, which means any questions anybody has about the patient, anything that needs to be ordered, things that need to be followed up on, etc., you know, they kind of contact me. I'm kind of the first point of contact for that. There is always an attending on call with me, so if anything comes up that I don't feel equipped to handle, or I am unsure about, or anything like that, then I go to the attending. There is in-house call. So, you know, when you're on in-house call, it's a little bit different because you are physically in the hospitals. So as I'm kind of sitting here in the car, I'm still getting messages on my little Epic chat from people about different patients, and I just answer them. It's kind of like, it's super convenient. It's almost like as if it were a little text thread. And so I answer them through the secure chat, and that's it. So I answered a couple right now. Now I'm about to drive over to the gym and get a good workout in. I'm at the gym and I just got a message with a consult, but it turns out it's the consult that I just saw before coming here, but they just heard about it. So I told them I already saw the patient, wrote the note, and everything's done. I stopped and got food. Because, like, you can't fall asleep if you're eating, right? ¿Estás enojada? Another message. Good morning. What is this fog that's going on today? Anyway, last night I went to sleep around 10 p.m. Surprisingly enough, I did not get a single message after like 10 p.m. until I woke up this morning. And at 10 p.m. I fell asleep, and then at midnight I woke up because I realized I hadn't eaten dinner before falling asleep because I was so tired. I have this bizarre fear of like sleeping through my entire call. Actually never happened, but I'm scared it will at one point. Oh, the sun came out. It actually looks so nice. I'll show you. Look. Like, hi, this is my medical student. Hi. How are you liking the rotation so far?
It's good. A lot of variety.
That's good.
Well.
She has to say that, of course. The patient is ready in the OR, so I need to run over there. Alright, I'm gonna get myself a little cafecito and then head over to the office. We finished up our first surgery and now I have some notes to finish up. I'm gonna go over to grab some lunch and then I'm gonna go over to the gym and then kind of hang out in case there's something else that I need to come back for since it's still a little bit early. And then go home. I just want to say that I just had the best lobster ravioli of my life. I got a message about a patient that we put in orders for discharge, but now she's having some vomiting. So I spoke with the resident about that and that's handled. I got a message from one of the attendings who discharged one of our patients and she was just letting me know that the patient was discharged. And then I got another question about another patient that wasn't a big deal. So we'll see how it works. We might get my head in it. Don't make me laugh, I can't. My strength disappears when I laugh. I am on like 3 different message threads since I got here, so I've been like working out and answering messages as I go along. Just got home, but I got a couple messages, so I need to put in an order for a patient and then I will shower and answer any more messages that come up. I'm on call until tomorrow morning at 8 a.m. And then I will be off call for my 120 hours straight on call. Guess who's not on call anymore? Okay, just saw all the patients and I saw the new consults and we are adding one of them to the OR. And technically I'm not on call because it's past 8 a.m. but I'm still working today. So I'll be here till 5 a.m. seeing all the consults anyway. But after 5, I will not be on call today.